The thyroid is a gland in our neck. It actually sits right here under where my tie knot is, and it's actually very important for a lot of metabolic functions that our body does on a day-to-day basis. There are several things that can go wrong with the thyroid. The thyroid can sometimes be overactive, and sometimes it can be underactive. And when you have an overactive thyroid, you might have symptoms like feeling hot all the time, feeling like your heart racing, feeling sweaty or anxious or jittery, and you might even lose some weight. And if your thyroid is underactive, you kind of have the opposite symptoms. You might feel cold, gain weight, tired, dry skin, brittle nails. And so all of these things can be tested with simple blood tests. To treat an underactive thyroid, often we just replace the thyroid hormone that you're missing. To treat an overactive thyroid, we often have to do other tests to figure out why your thyroid is overactive. There are several reasons. You could have nodules that are overactive. You could have something called thyroiditis, where your thyroid gland is just inflamed and making extra thyroid hormones or releasing them into the blood. Or you could have antibodies that stimulate the thyroid to make more thyroid hormone. And depending on why your thyroid is overactive, it really dictates the type of treatment we do. The other thing that sometimes people have that could go wrong with their thyroid is they can get nodules, and these are little knots or masses that form in the thyroid. Those can sometimes be cancerous, although 90 to 95% of the time they're not. If you have a nodule and we think we need to do a biopsy, and if it's benign, then you don't need to, then often we can just follow it and don't have to do any other treatment, and we just monitor it with ultrasound. If we find out that it might be cancerous, then usually the next step is surgery, and then that sometimes can also be followed by radiation.